The human face. We all have one, but not all of our faces develop in the same way. Some faces will never reach their genetic potential. Yes, there is a genetic code that determines your eye color, tooth size, etc., and a lot of other information about how your face should look. But there are many variables that are influenced by outside or environmental factors. These determine to a great degree how your face, specifically your lower face, will develop. We'll go into these factors more a little later, but first let's look at what makes a face both structurally sound and aesthetically balanced. Certainly, at the center of this is the balance and relationship between the upper and lower jaws. We have all seen faces where the lower face is set back, it's recessed. This is often accompanied by a narrow arch form, where the teeth are also set back in the mouth and less visible. Let's take a look at this illustration. We see a face that looks relaxed and harmonious. The upper face is in balance with the lower face. This exterior view tells us a lot about what is going on structurally below the surface. From this image, I would expect teeth that are relatively straight and arch forms that are broad, showing teeth and not shadows at the corners. Let's say that as a child, this patient had chronic trouble breathing through her nose. This is very common, and factors include allergies, enlarged tonsils or adenoids, and deviated septums, just to name a few. Chronic mouth breathing causes a lot of changes to the face. You'll notice that when we breathe through our mouth, the tongue drops down to the floor of the mouth. As this happens, the upper and lower arch forms begin to narrow, and the teeth tend to crowd. The upper front teeth can often incline back, and the lower jaw will often recede. These changes to the face not only cause aesthetic compromises, but they cause structural changes that can influence the presence of TMD disorders, neck stiffness, chronic headaches, and sleep apnea. With women especially, a recessed lower jaw is often accompanied by TMJ pain, headaches, facial pain, or neck soreness, perhaps even ear congestion. This is often due to the fact that the muscles are overworking to bring the jaw into this recessed position. When muscles are made to work excessively beyond normal function, they oftentimes will spasm, fatigue, and exhibit pain. Other supporting muscles of the head and neck will try and compensate for this, and they can often become strained and overworked and painful as well. Bring these muscles to their normal lengths, and they can relax and contribute to overall neuromuscular balance and harmony. This translates to less pain and a beneficial decompression of the jaw joint. A constricted arch form can force the tongue back in the mouth and interfere dramatically with the airway. This can cause snoring and often sleep apnea. For more information, go to sleepapnea.com. Sleep apnea affects both children and adults, and it is associated with serious medical complications. When I see this type of situation, I typically begin by expanding the arches with a fixed expansion appliance, which can be worn comfortably. What does this do? It creates room for the crowded teeth to fit. It also broadens the smile. As we advance the upper front teeth and bone, it also allows for increased tongue space. This appliance is typically worn for 3 to 4 months. After the arch forms have been developed and the upper recessed teeth have been postured forward, one thing that I like to do with chronic jaw pain patients is to fabricate a clear, anatomical, removable appliance that, when worn, will advance the lower jaw to a more forward position when the patient closes down. This decompresses the joint and allows those muscles involved with chewing to relax. This appliance is a great, non-invasive way to determine whether or not the desired changes are occurring. When the appliance is not worn, the patient's bite returns to its original, painful state. If we find that the appliance is bringing the desired relief, we then can change the bite relationships in order to make this change permanent. On a trial basis, we can advance the lower jaw using the removable appliance I mentioned before. Once we have determined the proper jaw dynamics, we then bond tooth-colored composite to the biting surfaces of the back 2 teeth on either side. We then bond composite to the backside of the 2 front teeth, thus creating the stability needed to hold the bite in the new, correct neuromuscular position. Now, the patient can only close their jaws in this new, aligned position. We then place clear braces and a special arch wire, which aids in raising the lower teeth so that they properly contact the upper teeth. The braces move the lower teeth into the desired position.
First time I saw Dr. Perkins, he said, "You have headaches all the time, don't you?" And I said, "Yeah, how do you know?" He goes, "I can fix that." And what he did is he moved my jaw forward. And in 2 weeks, my headaches were gone. I had a dull headache forever, and they were gone.
Finally, we have achieved a new bite relationship, a jaw position where the muscles have found comfort and harmony, an improved facial profile that allows for adequate tongue space, and we have better airflow. All this is achieved with totally non-invasive techniques. And as an added value, as you advance the upper and lower jaws, the soft tissue is gently stretched out, creating a pleasing facelift effect. The process generally takes 6 to 12 months. I'm Dr. Bob Perkins, and thank you for watching.